The BAPS system is a rehabilitative tool used by physical therapists, physiotherapists, and athletic trainers to rehabilitate ankle and lower leg injuries. Let's take a look at the design of the BAPS board and discover why the BAPS system is the best tool to use when rehabilitating a patient. The Pro BAPS board is an irregular shaped disc that is mathematically designed with multiple vectors. One side of the board is for the right foot, while the other side is used for the left foot. The length of the board from the center point of the foot pad varies in distance around the board, creating multiple ranges of motion for the ankle. The vector length across the board allows the outer ankle a greater range of motion and the inner ankle a shorter range of motion. This is also true for the range of motion when moving the foot and ankle going in a forward and backward direction. This biomechanical design allows the exact range of motion needed for every angle of the ankle to achieve the desired flexibility. How does the BAPS board differ from other balance boards? With a round circle balance board, the center point of the board gives equal amount of range of motion right to left and back to front. The same is true for square balance boards. The ankle isn't built for that kind of motion. That limited range of motion to the ankle increases the likelihood that the ankle will be injured. The BAPS board is designed for the correct range of motion according to what the ankle can do. This is why the BAPS board is biomechanically designed to fit the actual range of motion that the ankle is naturally designed to achieve. There is an ingrained footprint that is placed over the top of the center peg. Strategically located through the middle of the footprint is the malleolar axis line. This line is used to line up the lateral malleolus and the medial malleolus of the ankle. Around the footprint are 5 different peg positions. A weight rod is screwed into these positions so that weight plates can be added to strengthen the appropriate ankle and leg muscles. A blue hemispheric ball is screwed into a screw hole located directly underneath the footprint on the underside of the board to elevate the foot off the ground. It is important to understand the weight rod peg positions are biomechanically placed around the perimeter of the ankle to achieve greater strength for specific ankle muscle groups. The peg positions are labeled as follows: AL, anterior lateral; PL, posterior lateral; P, posterior; PM, posterior medial; AM, anterior medial. As mentioned before, the hemispheric balls are used to elevate the board off the ground and provide varying ranges of motion. Level 1 provides the shortest range of motion, while Level 5 provides the greatest. These balls are screwed into the underside of the board directly below the footprint. This creates a position that allows the board to be gradually heightened off the floor, starting with the smallest ball number 1 and gradually increasing the range of motion until the client has mastered the Level 5 ball. Each weight plate weighs 2.5 pounds and are added to the board to strengthen the ankle and leg muscles. The therapist or trainer will simply screw in the weight rod into the desired location and add the appropriate weight to achieve the desired result. If the trainer or therapist would like their client to be barefoot when using the board, there is a DISOM footprint pad that can be applied to the top of the footprint on the BAPS board. This will allow the patient's foot to comfortably grip the board. The yellow range limiter clips onto the blue BAPS board and is designed to limit the range of motion as desired by the physical therapist. This is typically used for clients who have a greater loss of motion from injury and need to start off very slowly to prevent further injury. Protocols of use of the BAPS board are physician, therapist, and client-driven. Before beginning an exercise or therapy session with the client, there are some questions that every therapist or trainer will want to answer first. 1. What are the intentions of the activity? 2. What is the client's ability to do this activity? Can they stand and bear weight on their foot? Can they only bear partial weight on the foot? If the client can only bear partial weight on the foot, the therapist or trainer may want to consider placing the BAPS board between parallel bars or between 2 chairs so the client can rest their hands on top of the back of the chairs to hold their weight. A walker will also work very well. The client can stand bearing their weight on the walker as they use the BAPS system to strengthen their ankle and leg muscles. If the client cannot bear weight on their foot, they can sit down in a chair, placing their foot on the board and then rotate the board back and forth and clockwise and counterclockwise. Another option that is very effective is to have the client sit on a weight bench. This will allow the therapist or trainer to move the board partially under the bench to close in on the distance, so the leg does not have to be extended too far. As the client uses the BAPS system, it is important that they master each level of the balls, achieving the desired flexibility before adding weight so as not to strain the ankle and leg muscles before moving on to the next ball level. To begin using the hemispheric balls, simply begin by screwing in the level 1 ball in the underside of the board, which is strategically located at the center of the footprint. Have the client place their foot on the footprint on the top of the BAPS board, then ask the client to rotate the board clockwise and then counterclockwise, making sure the client's head is up and their eyes are looking forward. 10 to 12 revolutions are an appropriate amount of use. However, this is entirely at the discretion of the trainer or therapist. Each one of the hemispheric balls screws into a wall rack and hangs neatly on the wall out of the way of the physical therapist and client. When you are done using the BAPS board, you can simply hang it up on the hook at the bottom of the wall rack unit. Now, let's talk about proprioception. Proprioception is the ability to know where one's body is in a given space and the ability to look away and then come back to a control spot. To increase proprioception, have the client find their center balance point and then look over their shoulder. Next, have the client close their eyes and move the board forward and backward and then side to side. Have the client open their eyes and come back to the control spot, head up and face forward. Now do this for the opposite shoulder. Repeat this several times. This activity will increase proprioception and will improve the client's ability to balance themselves on the injured ankle. The BAPS system can also be used for the upper body, such as the arms, shoulders, and for scapular stabilization work. Here are some examples. Have the client kneel on the floor and place both hands on the board, moving the board clockwise and counterclockwise. The therapist can have the client widen or narrow their hands for more or less control as they progress through the level 1 to level 5 hemispheric balls. The client can also place their hands on the board with fingertips out and with their fingertips facing in, as well as staggering the hands, right hand forward and left hand back, then the left hand forward and right hand back. The therapist may want to instruct the client to move their body further away from the board or closer to the board to allow other muscle functions, or have the client conduct a push-up with their hands placed directly on the board. Pediatric therapists often use the yellow satellite boards for their clients, using the same methodology in creating strength in the ankle and lower leg as well as a greater range of motion. Once their client masters the satellite, they can then begin them on the more advanced and challenging Pro BAPS system. CPT codes and billing. Physical therapists will build under neuromuscular re-education. Neuromuscular re-education is designed to engage the neurological system and the muscular system simultaneously. In order to bill for use of the BAPS, a PT must follow the 8-minute rule. They must conduct BAPS exercises for a minimum of 8 minutes. The reimbursement amount from Medicare varies according to state, so be sure to click on our link on the website under CPT codes and billing to determine the reimbursement amount for your state. Each time a clinic or PT uses the BAPS system with a patient for the minimum amount of required time, they will be reimbursed for the correct amount. How does the BAPS board pay for itself? If a clinic or PT bills each time they use the board with a client, they will be reimbursed for that time. Example: 20 patients per month times 4 weeks times 3 times per week times $46 equals $11,040 reimbursement amount for that month. The Pro BAPS system is only $650, so the BAPS system has now paid for itself and made the clinic or physical therapist an additional profit of $10,390.01 per month. The BAPS system is the best platform system on the market to rehabilitate ankles and lower leg injuries. In addition to getting the biomechanical advantage, clinics will also make additional income by using the BAPS system every day to rehabilitate their clients. Get your BAPS system today and you can purchase the system directly from the manufacturer. Go to www.spectrumtherapy.net.